Hi everyone. Today's class is about fundamentals in tooth preparation. In restorative dentistry, we know that in order to restore a tooth, we need to prepare a cavity on the tooth. And there are certain fundamental principles for preparing such a cavity. So let's today discuss about the general fundamental or principles in cavity preparation, or in other terms, the fundamentals in tooth preparation. The definition of tooth preparation is the mechanical alteration of defective, injured, or diseased tooth to receive a restoration material that reestablishes a healthy state for the tooth, including aesthetic corrections were indicated and normal form and function. So, following the definition of tooth preparation, we need we have certain objectives for the fundamentals of food preparation. The first objective is the removal of all defects and give the necessary protection to the pulp. As stated in the definition, the cavity preparation starts with the removal of defective, injured, or diseased tooth. So the first objective is to remove all the defects and give necessary pulp protection. And second objective is to locate the margins as conservatively as possible. As the fact as the specialty of dentistry is concerned with conserving the tooth, the preparation, the tooth preparation should also should be conservative as possible. The third objective is that from the cavity, form the cavity so that both the respiration and the tooth can withstand load of mastication. That is, the tooth should have the necessary resistance features that would resist the occlusal forces that is acting on the tooth, which will enhance the strength of both, it will prevent the fracture of both respiration and also at the same time the tooth. The fourth objective is to allow for the aesthetic and functional placement of a respirating material. The prepared cavity should allow aesthetic placement of a respirating material and also should replace uh, its functional properties. And there are certain general features for every cavity. They are features like walls, angles, and floor. We know that a cavity can have more than has will always have more than four walls, and angles is divided into two types of angles, that is line angles, point angles. The line angles are the junctions between two walls, or junction between a wall or a floor, and point angles is a junction of three such areas, that is either two walls or three walls, or two walls and a floor. And of course, the last feature is the floor. This diagram depicts the different line angles and point angles which is present on a class 2 cavity. So, for example, axial pulpal is a line angle that forms the margin between the axial and the pulpal floors. Whereas the distal faciopulpal point angle forms the junction between the distofascial faciopulpal and the pulpal floor. So point angle is formed by three planes, whereas line angle is formed by two planes. Another example of class 5 cavity shows the different line angles and point angles on the class 5 restoration, cavity preparation. And every cavity preparation has two steps, that is initial cavity preparation and final cavity preparation. So coming in detail into the initial cavity preparation stage, the step one consists of outline form and initial depth. Step 2 consists of primary resistance form. Step 3 consists of primary retention form, and step 4 consists of convenience form. And in final cavity preparation, we have step 5, which is removal of any remaining infected dentine if indicated. Step 6, pulp protection. Step 7, secondary resistance and retention. Step 8, procedures for finishing external walls. Step 9, cleaning, inspecting, and sealing. Now let's see each step in detail. Under initial cavity preparation stage, our first step was outline form and initial depth. So let's see what is outline form and initial depth is. By definition, outline form is defined as placing the cavity margins in the positions they will occupy in the final preparation. So it is like a blueprint or a plan to a restoration. We will decide where the margins of the cavity preparation should be there in the final preparation. So placing the cavity margins in the position they will occupy in the final preparation is roughly defined as outline form. And what is initial depth? Initial depth is the depth of the cavity that we are preparing for example, for amalgam preparation, it is zero point 0.2 to 0.8 millimeter pulp of the dentative enamel junction, irrespective of the extent of caries. So, initial depth is preparing an initial depth of zero point 0.2 to 0.8 pulp of the dentative enamel junction. For this diagram represents the outline form of different cavity designs on molars and on a molar tooth. The first picture depicts the outline form of a class 1 cavity, and the second picture depicts the outline form of a class 2 cavity. This is the initial diagram which shows the initial depth of a amalgam cavity preparation. In this, the initial depth is on the occlusal surface, it is 0.2 millimeter, and on the proximal surfaces, it is 0.75 to 0.8 millimeter past the dentino-enamel junction. So this is the initial depth. So what are the principles of outline form? The principles of outline form is that all friable or weakened enamel should be removed. As we all know that the weakened tooth structure by definition should be removed, which is a principle, which is one of the objectives of cavity preparation. So all friable and weakened enamel should be removed, and all faults should be included. If there are faults within the caries affected tooth, these faults should fall within the margins of the restoration. That is, the faults should be included. It should be eliminated. All margins should be placed in a position to afford good finishing. We have certain finishing steps during the end of the preparation. So all the placement of margin should be in such a way that it should allow proper finishing after the final steps are over. Margins of the preparation will be located on finishable or self-fencing areas. These are the principles of outline flow. Then let's see what are the features we incorporate in order to get these effects. So the first feature is that preserving cuspal strength. We know that the cusp are strong cusp are important structures which is present on the occlusal surfaces of posterior teeth. These give the strength for mastication and also for all other functions. So we need to preserve the cuspal strength when we prepare a cavity. The cusp should not be undermined. And another important feature on the tooth surface is the marginal ridge. So the second feature is preserving marginal ridge strength. And while preparing cavity, the facial-lingual extension should be minimized. That is minimizing facial-lingual extension. And the other thing is using the technique of enameloplasty. The technique of enameloplasty is that we will widen the narrow pixel fissures so that these areas become self-fencing. In some situations, when the caries is so extensive, if we cannot extend the cavity so much into the pits and fissures. So what we will do is that we will just widen these pit and fissures so that these areas will become self-fencing. This is known as enameloplasty. Connecting two closed faults or cavities. Suppose two faults are separated by a distance less than 0.5 millimeter. These 2 points are connected and restricting the depth of the preparation into the dentine. We should not go too much into the dentine so that the underlying pulp will be irritated, will get irritated. So we should restrict it to the minimum, that is 0.2 to 0.5, 0.8 millimeter past the dentino-enamel junction. And there are certain rules in the initial cavity preparation, that is outline form and the initial depth, is that capping of cusp should be done when cavity extension is 2/3 from the central fissure to the cuspal areas. If the caries is extending more than 2/3 from the central fissure to the cuspal areas, that cusp should be capped. And the cavity preparation should include all fissures that cannot be eliminated by enameloplasty. and the depth of the cavity should be restricted as much as possible. The preparation should be conservative as possible. We should join two lesions if they are less than 0.5 millimeter apart, which I have explained earlier. Coming into the second step in initial cavity preparation, that is primary resistance form. Let's see what is primary resistance form now. The shape and placement of the cavity walls that best enable both the restoration and the tooth to withstand without fracture masticatory forces delivered principally in the long axis of the tooth. We know that the forces acting on the tooth mainly acts on a vertical direction towards the pulp in oral cavity. There can be combinations of tensile, compressive, and uh, shear forces. So, during all these kind of forces, the cavity should withstand these masticatory stresses. Both the cavity, the tooth, and the restoration should withstand. The features which we incorporate to attain this goal is known as the primary resistance form. And let's see what are the features of primary resistance form. The first feature is a box shape. A boxy shape to the cavity will provide the resistance form to the tooth because a boxy shaped cavity will hold the restoration in place. Will In this diagram, as you can see that the first picture depicts the correct preparation for amalgam cavity, that is a boxy shaped cavity. What will happen if the cavity is rounded or without definite boxy shape? If the occlusal force is acting, the restoration will rock inside the tooth and it will result in the fracture of the tooth. But in case of boxy shaped preparation, the force will be dissipated equally along the walls, and so that the restoration and the tooth both will have the adequate resistance features. And in order to get proper dissipation of occlusally directed forces, the cavity should have a relatively flat floor, which is the second feature of resistance form. And inclusion of weakened tooth structure. All weakened tooth structure which is prone to fracture during masticative forces should be eliminated. Preservation of cusp and margin ridges. As we have discussed earlier, if the caries extension is extensive or it is beyond two-thirds of the cuspal from the central peak to the cuspal eminence, that cusp should be incorporated into the restoration. And margin ridge, if it is too weak, we should include it in the preparation. And we should not unnecessarily extend our preparation to sound margins of the tooth. Rounded internal line angles is another resistance feature which will prevent the wedging action of the restoration and which will result in which will prevent the tooth from getting fractured. Adequate thickness of the restorative material is also an important feature for the restoration to withstand within the mold. For amalgam, we need a bulk of at least 2 millimeter for its proper strength. So adequate thickness of the restorative material should be there. For that, the cavity should have adequate depth. Reduction of cusp for capping is indicated as explained in the fourth point. The cusp, if it is weak or if it is extensively affected by caries, should be reduced so that it could be incorporated into the restoration, which is in other words is known as cusp capping. Coming into the third important step in the initial cavity preparation, that is primary retention form. What is retention? What are the primary retention forms which we incorporate into the tooth? The primary retention form is a shape or form of the prepared cavity that resists displacement or removal of the restoration from tipping or lifting forces. That is, it is basically the feature that helps the restoration to stay within the tooth. That is, the shape or form of the prepared cavity that resists the displacement of or removal of the restoration from the tipping or lifting forces. There are two important features which we incorporate in the tooth which will help to achieve this. The dovetail design provides retention form to the occlusal portion of the cavity. As you can see that the dovetail is an important feature that will help the restoration to stay within the tooth. And occlusal convergence of the walls offer retention in the proximal portion of the cavity against displacement of occlusal. As we know that the amalgam preparation is prepared with occlusal convergence, which will prevent the material from dislodging from within the cavity. And for materials like composite, a mechanical bond or micromechanical bond is created between the material and the condition prepared tooth structure. The fourth step in initial cavity preparation is the convenience form. Convenience form is the shape or form of the cavity that provides for adequate observation, accessibility, and ease of operation in preparing and restoring the cavity. So it simply states that the cavity should have a particular width for the proper observation and also for the accessibility of the instruments and also for the ease of operation and conducting and restoring the cavity. So that is by that we have completed the initial tooth preparation steps. Now moving on to the final cavity preparation stage. In final cavity preparation stage, the first step is removal of any remaining infected dentin if indicated. We know that in the initial cavity preparation, the depth is limited to zero point 0.2 to zero point 0.8 millimeter from the DEJ. And what if the caries is still present? If there is still caries present, we should remove the caries only on the areas where there is soft dentin or affected dentin. Sorry, where there is infected dentin. And this infected dentin is removed by using either a slow speed burr or by using specialized hand instruments like spoon excavators. So removal of any remaining infected dentin, if indicated, is the first step in final cavity preparation. And what will happen, and something which follows this removal of remaining or infected dentin is the pulp protection. We know that the material which we keep in the cavity can irritate the pulp, but especially in case of amalgam restoration, the amalgam is a metallic restoration. It can conduct heat. So if the pulp is not properly protected, the amalgam restoration can induce pulpal damage. So for making it is same in different type of material, depending upon the nature and properties of the material can irritate the pulp. So in every cases we should try to protect the pulp by giving proper lining or bases on the floor of the cavity. So using liners or bases to protect the pulp or aid pulpal recovery or both. Suppose if the pulp is exposed hypergently, we need to place a certain medicament which helps in the repair of the pulp. So that is also comes under the objective of pulp protection. So in this diagram, you can see that there is a minimum preparation in the first diagram, which does not require any pulp protection because there is enough dentin from the pulp to the restoration. But in case of a deep preparation, we know that the pulp is already approaching here. So what we do is we place a material like calcium hydroxide, which is known as a liner. On top of that, we'll place a layer of restorative material, which is known as the base. And on top of that, we will place the final restoration amalgam or cast metal or whatever it is. So that is the basic principle of pulp protection. Coming to the seventh step is secondary resistance and retention form. As we know that we already discussed about the primary resistance and retention form for amalgam restoration and also for composite. And depending upon the complexity of the cavity, that is, if the cavity is so big, the conventional primary retention and resistance features may not hold good. So we need to incorporate certain secondary resistance and retention forms. So complex cavity preparation require additional resistance and retention form. The exception being those preparations that are very conservative. These features are retention locks, grooves, and coves, screws, extensions, skirts, beveled enamel margins, pins, slot, steps, and amalgam pins. These are examples of retentive locks. This is an example for slot, and certain cases we use amalgam pins for retaining amalgam in a complex amalgam restoration. These are diagrams which depicts coves and dentin slots. The eighth step in final cavity preparation is the procedure for finishing external walls. Finishing the preparation walls is further development of a specific KO surface design and degree of smoothness that produces the maximum effectiveness of the restorative material being used. So this step depends upon the restorative material which you are using. For example, for amalgam cavity, the KO surface margin is 90 degree, but for composite it is different. For composite, we need to give a bevel throughout the margins of the restoration so that it increases the surface area of the restoration. And in other restorations like cast gold restoration, a bevel will help to burnish the margins of the restoration and adapt the restoration without creating gaps between the restoration and the tooth. So the external wall finishing depends upon the type of restorative material which is used. This picture depicts the direction of enamel rods, which in this case, the design of KO surface angle depending on the material. For example, for amalgam, the KO surface margin is 90 degree, and for composite, we give a 30 to 40 degree bevel at the KO surface for improving the bonding of composite. Uh, One of the feature which comes under the this step is that beveling of the gingival seat. As you can see in this picture, the direction of enamel rods in the cervical region of a plastic preparation is oriented gingivally or cervically. So there is an unsupported enamel in this area, and when we place a restoration here, this there is great chance for the unsupported enamel to fracture. So in order to prevent that, what we'll do is that we will bevel this gingival margin by using particular instrument known as the gingival margin trimmer or GMT. A 15 to 20 degree bevel is enough to remove the unsupported enamel in this area. So the KO surface margin and the KO surface margin is kept to 90 degrees in this area. So the beveled gingival floor the enamel provides is created in order to protect the tooth from getting injured due to the presence of unsupported enamel rods. And in case of composite, an unbeveled surface looks something like this, and a beveled surface looks something like this. If we bevel the tooth for composite restoration, it exposes rod ends, which is easy to get etched, and so that the surface area is improved, and the resin can flow in this area and form micro cracks. On the other hand, if the area is not beveled, the rod ends are not exposed for etching. Only the sides of the enamel rods are available for etching. The sides of the enamel rod will not provide much area for the resins to infiltrate. That's why in a composite restoration, it is always advisable to give a bevel which will expose the rod ends for etching. The final step is cleaning, inspecting, and sealing. The final procedures begin with cleaning the cavity with proper agents so that all the debris and even the smear layer is removed. This step depends upon the restorative material which you are using. Uh, for example, the composite restoration, there are two schools of thought in removing the smear layer and not removing the smear layer. Modern composite rely upon the smear layer for its it relies the presence of smear layer, and it takes advantage of the smear layer. But traditional restorative material like amalgam and all does not require the presence of a smear layer. So cleaning step, that is removal of any smear layer or other debris, depends upon the restorative material which you are using. But the cavity should be generally clean, free of debris or loose tissue or any other old filling materials or restorative materials should be completely eliminated. And it is advisable to clean the cavity with some agents like chlorhexidine prior to restorations like composite restoration. It will improve the longevity of the restoration because the dentin matrix proteins which is released from the prepared exposed dentin can result in the degradation composite on the long run. So we can treat the cavity with agents like chlorhexidine, which will inhibit these enzymes. And finally, we should inspect the cavity for any defects, flaws, or if there is any areas which is not included in the preparation. and we should inspect thoroughly the cavity for any remaining caries. For this, we can even use caries disclosing agents or solution, and the cavity should be properly inspected for any crack lines or any other uh, procedural errors. For amalgam restoration, we need certain step like varnishing, applying application of varnish, because the corrosion products on the amalgam can penetrate through the dentinal tubules and cause a discoloration to the tooth and even irritation to the pulp. And the bases which we use below the amalgam restoration, like zinc phosphate, the phosphoric acid can leach through the dental tubules and cause irritation. So in order to prevent such nitrogenic errors, we can apply a layer of varnish on top of below the restoration, so that it will not leach out into the pulp space. One thing which we need to note is that the application of varnish depends upon the base type of base which you are using. For zinc phosphate, the varnish should be applied on the floor, and only on top of that the base is applied. But for zinc polycarboxylate, there is chemical bonding that is taking place between the tooth and the base. So, and the zinc polycarboxylate is less irritant to the pulp. So, what we'll do is that we place the base first, and then only on the walls we will place the varnish. And on top of that, we will place the amalgam restoration. So that is about varnishing. And the final step, that is conditioning, it is used in case of adhesive restorations and also for composite restoration. For adhesive restoration like GIC, we'll condition the tooth surface with polyacrylic acid, 10% polyacrylic acid, which helps to remove the smear layer and helps to wet the collagen, so that it will facilitate the penetration of the GIC. So that, and it will create a better bond with the tooth. For composite restoration, the conditioning is again needed for modifying the smear layer and help to make it more hydrophilic, so that the resin will penetrate into the dentinal tubules and causes proper penetration of the resin and causes better bond into the tooth structure. So these are the final procedures which is involved in the cavity tooth preparation. So this is by this we complete the fundamentals of cavity preparation. So basically, the fundamentals of cavity preparation, we discusses about the various objectives of cavity preparation, the ideal principles, the ideal features that will exist in a cavity, and it is broadly divided into two categories, that is initial cavity preparation and final cavity preparation. Under initial cavity preparation, we have four steps, that is outline form and initial depth. Initial depth is usually 0.2 to 0.8 millimeter from the DJ, and we have primary resistance, primary retention, and convenience form. In the final cavity preparation stage, we have five steps, which include removal of any remaining infected tooth material and protection of the pulp, secondary resistance and retention form, and finishing of external walls, and final step of cleaning, inspecting, and sealing. One thing which we need to understand that is that all the features which is discussed above depends mainly upon the type of restorative material and the extent of caries. So these two things dictate the features which we incorporate into a tooth preparation. So for amalgam preparation, the design and fundamentals will be different, but composite will be different. It will be different for GIC, but the general principles and objectives remains the same. That is, the tooth and the restoration should withstand masticatory forces. It should fulfill all the objectives of cavity preparation. It should functionally and aesthetically should restore the normal form and function of the tooth. And by this, I end up in this class on fundamentals of tooth preparation. Thank you. You should read about more about this in your textbook. Thank you.